I'm a doctor, and I need to tell you something the medical system doesn't want you to know. Your neuropathy treatment is designed to fail, not by accident, by design. And in the next few minutes, I'm going to walk you through exactly how the $50 billion pain management industry keeps you on a hamster wheel of prescriptions that never actually fix the problem, and what they're hiding from you about what actually works. If you're taking Gabapentin, Lyrica, or any other type of nerve medication, and you've been on it for months or years with no end date in sight, this video will change how you see your treatment forever, because the truth is you're not gabapentin deficient. Neuropathy isn't caused by a lack of medication in your body, but the system profits when you believe it is. By the end of this video, you'll understand the financial incentives keeping you in pain, why your prescription bottle doesn't have an end date, and what actually happens when you treat all three root causes of neuropathy at the same time instead of just masking symptoms. I know this sounds cynical. I know it's uncomfortable to question whether the system you trusted is actually designed to help you get better. But if you've been told your neuropathy is permanent, if you've been on the same meds for years with no improvement, if you're starting to lose hope, you deserve to know the truth. And the truth is this: a patient cured is a customer lost. That's not me being dramatic. That's the model. Now, I've worked with hundreds of neuropathy patients who were told that they'd be on medication forever, who were told surgery was their only option, who were told to just manage it. And when we actually address the root causes, inflammation, nerve compression, and circulation together at the same time, well, guess what? They get their lives back. They walked again. They slept through the night. They canceled surgeries, not because it's a miracle drug, because we stopped treating symptoms and started treating the problem. Right, point number one, why your prescription bottle doesn't have an end date, and what that tells you about the system's real incentives. When you get a prescription for neuropathy, that's gabapentin, Lyrica, opioids, blood pressure meds, how many times are you given an actual end date? Go look at your bottles right now. You won't find one. You'll find a refill date. That's it. Refill, refill, refill forever. And here's the thing, that's by design, because in the current system, the way it's set up, keeping you on those medications indefinitely is how they make money. You're not getting better, you're getting managed. And managed means you keep coming back. Neuropathy is not a disease caused by lack of gabapentin in your body. You're not gabapentin deficient. You don't have a Lyrica deficiency, but the system treats you like you do. Because if they actually fixed the problem, you wouldn't need the prescription anymore. And that's bad for business. Think about it. When's the last time a doctor sat you down and said, here's the plan to get you off these meds in 6 months? Never, because that conversation doesn't exist in this model. The conversation is always about adjusting the dose, adding another medication to manage side effects of the first one, trying a different brand of the same drug class, but never about ending the need for the drug altogether. If your treatment plan doesn't include an exit strategy, if no one has ever talked to you about getting off these meds, you're not in a healing protocol. You're in a revenue stream. And the difference between those two things is everything. Point number two, the financial model that keeps you stuck and why a patient cured is a customer lost. It's literally coded in the system. The current system is designed to keep you in a hamster wheel of just managing symptoms. Managing, all while the actual problem gets worse and worse and worse. And as it gets worse, you need more of the thing that's keeping you stuck. More meds, higher doses, additional prescriptions to manage the side effects of the first prescriptions. And here's the part people don't want to say out loud. Pharmaceutical companies, insurance companies, they're making a killing by keeping you on this wheel. According to Grandview Research, the US pain management market is expected to exceed $50 billion by 2025, driven primarily by pharmaceutical sales of opioids, gabapentinoids, and NSAIDs. The global gabapentin market alone is projected to reach $4.2 billion by 2028, with neuropathic pain being the largest indication. Now, I don't know where this is coded, but it's somewhere. A patient cured is a customer lost. And that doesn't work well for their board members. It doesn't work well for the people whose pockets are getting lined by this $1 trillion industry. And people ask me all the time, why doesn't insurance cover your program? Why don't they pay for the root cause treatment? That's it right there. When you actually fix the problem, they no longer need their services. You stop being a customer, and that's bad for their business. So here's what really happens. You go to your doctor with neuropathy symptoms. They prescribe gabapentin. You take it. Maybe it helps a little bit at first, but the symptoms, the numbness, it comes back. The tingling gets worse. So they increase the dose, or add Lyrica, or throw in an opioid for the pain. Now you're taking 3 medications and you're getting drowsy, brain fog, weight gain. So they prescribe something for the side effects. And now you're on 4 medications, all managing nothing fixing. And every month you refill. Every 3 months, you have a follow-up appointment. Every year, they run the same tests and tell you the same thing. Let's keep you on this regimen, because in their system, stable means success. Even if stable means you're still in pain. Even if stable means you can't feel your feet. Even if stable means you're afraid to leave the house because you might fall. When I work with a patient, my goal is to see them for a finite period of time. Get them better. Send them on their way so they can live life and enjoy the life they've worked so hard to earn. We did our job because we worked together to address the root cause and got the body healing again. If I'm not getting you better, if you're not improving, we're either missing something or there's something else going on that needs to be addressed. But keeping you dependent on me forever, that's not medicine, that's a subscription. Point number 3. Why physical therapy alone, injections alone, talking pain injections, or adjustments alone will never fix your neuropathy, and what actually works. Here's why. They're treating one piece of a 3-part problem, and until all 3 are addressed, you're going to stay stuck. Here's what they're not telling you. Neuropathy has 3 root causes working together: inflammation, nerve compression, poor circulation. And when you only treat one of them, the other 2 keep the problem alive. Dr. Aaron Vinnick wrote in the Journal of Diabetes Research that peripheral neuropathy is a multifactorial in origin, involving inflammatory cytokines, mechanical nerve compression, and vascular insufficiency. Single intervention therapies fail to address the compounding nature of these mechanisms. So you go to physical therapy, they work on circulation and movement. Great, but they're not addressing the inflammation that's attacking your nerves. They're not decompressing the nerves themselves. So you get a little relief, but it doesn't last. You feel a bit better for a few days, maybe a week, then the symptoms come roaring back and you think, well, I guess PT just doesn't work for me. Then your doctor tries gabapentin. It calms the nerve signals, basically numbs your pain receptors, but it's not reducing inflammation. It's not improving blood flow to your damaged nerves. It's not releasing the compression. So the damage continues underneath the numbing effect, and guess what? Eventually, the medication stops working as well because the problem gets worse. You didn't develop a tolerance, the disease progressed while you were numbing the alarm bells. Or maybe they send you in for injections, right? Steroid injections to reduce inflammation in a specific area. And yeah, that might help that one spot, but if you got nerve compression in your lower back and poor circulation in your feet, that injection, nope, it's not addressing those. So the relief is temporary, localized, and it doesn't stop the overall progression. This is why you tried so many things and nothing has worked. Not because you're infixable or unfixable, not because your neuropathy is too advanced, but because no one has treated all 3 causes at the same time. It's like trying to bail water out of a boat when there are 3 holes. You can focus really hard on one hole, but the other 2 are still letting water in. And eventually, you're going to sink. When you address inflammation and nerve compression and poor circulation all together, that's when people start walking again. That's when they sleep through the night. That's when they cancel surgeries and get off meds. That's when they get back to taking their vacations, because you're not managing symptoms anymore. You're removing the conditions that cause the symptoms in the first place. You're plugging all 3 holes at once, and that's when the boat stops sinking and starts floating again. Point number 4, the lie you've been told. Why your doctor told you your neuropathy is permanent, and why that's only true if you keep doing what you're doing now. I can't tell you how many patients come to me and say, my doctor told me this is permanent. They said, I'll be on meds forever. They said surgery might help, but probably not. And that's the moment where people start to give up, because if a doctor says it's permanent, well, it must be true, right? But here's what that doctor really means. With the tools I have, with the 12 minutes that I'm allowed to spend with you, with the treatment options insurance will pay for, with the medications I'm incentivized to prescribe, I can't fix this. That's not the same thing as it can't be fixed. It just means they can't fix it within that system. And look, I'm not blaming individual doctors. Most of them genuinely want to help, but they're trapped in a system that pays them for volume, not for outcomes. They get reimbursed for prescribing. They get reimbursed for procedures. They don't get reimbursed for spending an hour teaching you how to reverse nerve damage through inflammation control, decompression, and circulation restoration. The research shows something completely different from what you've been told. Dr. Douglas Zakhodny wrote in the Handbook of Clinical Neurology that nerve regeneration is possible when metabolic and mechanical stressors are removed. Schwann cells can remyelinate damaged axons, and microvascular circulation can be restored with sustained therapeutic intervention. In plain English, your nerves can heal, but only if you remove what's damaging them and give them what they need to repair. I've had patients who were told they need surgery. They told me they'd never walk again without a cane, told their neuropathy was end stage. And when we treated all three root causes together, when we got the inflammation down, decompressed the nerves, and restored blood flow, they got their lives back. Not because I'm special, because we stopped managing symptoms and started treating the problem. One patient came to me after she'd been told she'd be in a wheelchair within 2 years. She'd already lost feeling in both feet, couldn't drive, couldn't stand long enough to cook dinner. 3 different doctors told her the same thing. Permanent nerve damage, nothing we can do. Here are some stronger pain meds. Well, 6 months into our protocol, she was walking 2 miles a day, feeling returned to her feet. She drove herself to our last appointment and told me she was taking her grandkids to Disney World. Now, that's not a miracle. That's what happens when you actually address the root causes instead of numbing the alarms. So when your doctor says it's permanent, what they're really saying is, I've done everything I know to do within this system and it hasn't worked. And they're not lying to you. They're just operating within the limits of a broken model. But those limits aren't your limits. There's a whole world of possibilities outside that 12-minute appointment window. Look, if you're watching this and you're thinking, okay, this makes sense, but what do I actually do about it? Well, I've created a free training that walks you through the exact 3-step process we use to reverse neuropathy without surgery or medication. It's called the Neuropathy Freedom Blueprint. It's called the Renew Healing Process for Reversing Neuropathy Naturally. And you can access it at the link in the description. I'll show you exactly how we address inflammation, nerve compression, and circulation all at the same time, and what that looks like in real patient cases. It's completely free. No opt-in walls, no sales pitch, just the information you need to make an informed decision about your health. Point 5. What actually happens when your treatment has an end goal, and why I refuse to keep my patients on medications forever. Here's my belief. When I work with a patient, I want to see them for a certain finite period of time, get them better, and send them on their way so they can live the life and enjoy the life that they've worked so hard to earn. That's what success looks like to me. Not endless appointments, not lifetime prescriptions, not we'll manage this forever. And yes, of course, we'll be here if something comes up or you need support. But if I'm not getting you better, if you're not improving, then there's either something we're missing or there's something else going on that needs to be addressed. But keeping you dependent, that's not the goal, that's failure. In the current system, they celebrate compliance. They celebrate you taking your meds every day, showing up for your monthly follow-ups, refilling your prescriptions on time. But I don't want you to be compliant. I want you to be free of pain, free of numbness, free of the fear. This is just how life is now. So when people ask me, why does insurance cover this? Well, that's why, because we're not playing the same game. Their game is keep you in the system. Our game, get you out of the system. And here's what real treatment looks like. We start by identifying, which of the 3 root causes, inflammation, compression, circulation, is the primary driver in your case. For some people, it's systemic inflammation from diet, blood sugar, or autoimmune issues. For others, it's mechanical compression from the spinal misalignment or scar tissue. For others, it's circulation problems from sedentary lifestyle, vascular disease, or peripheral arterial disease. Usually, yeah, you're right, you guessed it, it's a combination. Then we build a protocol that addresses all 3 simultaneously. We're reducing inflammation through specific nutritional interventions and targeted supplementation. We're decompressing nerves through spinal adjustments, soft tissue work, or in some cases, specific exercises that create space where compression exists. And we're restoring circulation through movement protocols, vascular therapy, and in some cases technology that increases blood flow to damaged tissue. And here's the key. We're measuring progress. And it's not just, well, how do you feel today, but objective measures, nerve conduction studies, quantitative sensory testing, functional movement assessments. Because if the numbers aren't improving, we adjust. We don't just keep doing the same thing and hope for different results. That's insanity. Most patients start seeing real improvement within 3, 4, 6 weeks. And not just, I think it's a little better, but I can feel my feet again. I slept through the night without leg cramps, without holding onto a cart for balance. And we keep going until you hit your goals. For some people, that's 3 months. For others, more advanced cases, it might be 6 to 9 months. But there's always an end goal, always a finish line, because the goal is to get your body healing on its own, not to make you dependent on me forever. If your current doctor has never talked to you about an end date, they've never said, here's the plan to get you off those meds, you're not in a treatment plan. You're in a maintenance plan. Maintenance means you stay stuck. It means they've accepted that this is as good as it gets. But you don't have to accept that because it's not true. So here's what we've covered. Your prescriptions don't have end dates because the system makes money when you stay on them forever. The $15 billion pain management industry is built on symptom management, not healing. Single modality treatments fail because they ignore 2 out of the 3 causes. Your doctor told you neuropathy is permanent because they don't have the tools or the time to fix it within an insurance model. And real treatment means having an exit strategy, not a lifetime subscription. But here's the question I get all the time. Okay, I understand the system is broken. I understand why what I've been doing hasn't worked, but what do I actually do now? What does root cause treatment look like in practice in real life? What are the specific steps? And that's exactly what I'm going to break down in my next video. Now that you understand why the system keeps you stuck, you need to know what actually works. In my next video, what actually happens when you treat all 3 root causes of neuropathy at once, I'm going to walk you through the exact protocol we use and show you real patient stories of people who walked again, slept through the night, and got off meds for good. So if you're tired of being managed and you're ready to actually get better, that's the video you need to watch next. I'll see you there.